Steps of circumcision. Circumcision is a surgical procedure involving the removal of the foreskin, prepuce, from the penis. It is performed for medical, cultural, or religious reasons. Below are the general steps of the procedure. 1. Preoperative preparation. Obtain informed consent and explain the procedure. Ensure proper antiseptic cleaning of the genital area. Administer local or general anesthesia, depending on the patient's age and condition. 2. Marking the foreskin. The surgeon marks the area to be excised, ensuring precision and symmetry. 3. Retraction of the foreskin. The foreskin is gently pulled back to expose the gland's penis and determine the level of incision. 4. Application of a device or clamp, optional. Devices like Gomco clamps, Plastibell, or Mogan clamps may be used to secure and protect the glands while cutting the foreskin. These devices minimize bleeding and ensure a clean incision. 5. Excision of the foreskin. The foreskin is incised and removed carefully along the marked area. Care is taken to avoid injury to the glands and frenulum. 6. Hemostasis. Bleeding is controlled using electrocautery or sutures. 7. Suturing, if necessary. The edges of the remaining skin are sutured to ensure proper healing and aesthetics. 8. Application of dressing. A sterile dressing is applied to protect the wound and minimize infection. 9. Postoperative care. The patient is monitored for complications like bleeding, infection, or pain. Instructions for hygiene, pain management, and follow-up visits are provided. Circumcision is typically safe when performed by skilled professionals. However, meticulous care is crucial to prevent complications and ensure optimal healing. Advantages of circumcision. Circumcision, the surgical removal of the foreskin, offers several potential benefits. While the decision to undergo circumcision can be influenced by cultural, religious, or medical reasons, the following are its commonly cited advantages. 1. Reduced risk of urinary tract infections, UTIs. Circumcision decreases the risk of UTIs, particularly in infants and young boys. UTIs can lead to kidney problems if untreated, so this benefit is significant for some parents. 2. Prevention of penile disorders. Circumcision helps prevent conditions like phimosis, the inability to retract the foreskin, paraphimosis, the inability to return a retracted foreskin to its original position, balanitis, inflammation of the foreskin or glands. 3. Improved hygiene. Without a foreskin, it is easier to maintain genital hygiene, reducing the accumulation of smegma, a mix of dead skin cells and oils, and the risk of infections. 4. Reduced risk of sexually transmitted infections, STIs. Circumcision has been associated with a lower risk of acquiring certain STIs, including HIV, herpes simplex virus, and human papillomavirus, HPV. It also reduces the risk of transmitting some infections. 5. Reduced risk of penile cancer. Though rare, penile cancer is less common in circumcised males. This may be related to improved hygiene and reduced risk of chronic inflammation. 6. Potential benefits for sexual partners. Female partners of circumcised men may have a reduced risk of cervical cancer, potentially due to lower transmission rates of HPV. 7. Cultural and religious significance. For many, circumcision fulfills important cultural or religious obligations, fostering a sense of identity and belonging. While circumcision has advantages, it also carries potential risks such as bleeding, infection, or scarring. Decisions should be made after considering the individual's circumstances, consulting medical professionals, and understanding the associated risks and benefits.